An abnormal opening between the rectum, which is the motion passage, and the urinary passage or the urethra is called a rectourethral fistula. Fistula is an abnormal communication between two different passages and then start communicating with each other, sadly because of a new communication which has developed. Rectourethral fistula is that kind of a communication that develops between the urinary and the motion passage in men as a result of various injuries, various accidents, or sometimes various diseases and surgeries. An existence of a rectourethral fistula where the rectal contents or the fecal contents are coming in urine, or the urine is leaking via the motion passage or through the fecal matter, is something which is quite abnormal and needs a treatment and a cure. When we see such patients of impalement and a major perineal injury or post-surgical injuries where you have got a rectum and the urethra started communicating with each other, I think it's time to dismantle the rectum and the urethral fistula and then go down and repair it. That kind of a repair is a complex reconstructive procedure in the hand of a reconstructive urologist, where we as urologists would look forward to entering that area in the perineum through an incision which allows us to dismantle the fistula. The rectum is separated down and the urethra is separated up. This is a lot done by cystoscopic guidance in the early part where we look at calibrating and exactly looking at how the urethra looks like in such situations. We go down and sometimes use a finger guidance in the rectum as we dismantle the fistula, taking care of not creating extra injuries or holes in the rectum. Once that has been done, we repair the rectum separately and we repair the urethra separately. This is most commonly done in extended lithotomy position, but sometimes can be done in jackknife position and in positions which allow us a complete view of this very complex, deep location, deep in the pelvis and the perineum. Once the repair has been completed, then comes an important aspect of filling that entire gap where we've removed fibrous tissue, we removed all the callous tissue and all those aspects which would probably prevent from healing. But the space created needs to be then filled up in such a way that it does not let the two fistulae repair to be communicating with each other again. And that's where a gracilis flap or the muscle from the thigh in the medial aspect is brought down. And we bring about a gracilis interposition between the repair of the rectum below and the urethra above. So the gracilis, which is a muscle with a long tendon and a short belly, dismantled from the knee joint and is brought in internally from the space created along the thigh on the ipsilateral side, brought all the way down into the perineum, is then interposed with its belly coming down, with the entire thing being surviving on its proximal blood vessel, which is approximately 8 to 10 centimeters from the pubic symphysis. And that blood supply is maintained. I get to see these rectourethral fistula patients coming in from various war injuries in the Gulf countries, various kinds of road traffic accidents and impalement injuries and various traumas, and many a times post-disease and post-surgical exercise. So rectourethral fistula is for cure. Many a times, or almost always, we have a covering colostomy for the first few months, approximately 3 to 6 months, for allowing the fistula to heal completely. And once that heals and has completely settled down, and we look at the rectum and the urethra being two different passages altogether as friendly neighbors, then we look at closing the colostomy again and probably giving him back life. So friends, rectourethral fistula is completely treatable and curable. Requirement of an interposition flap as a plastic surgery procedure that we do as urologists is to bring about a prevention of communication between the two repairs together. And that's an important aspect of the whole repair, which cannot be brought out because there is no tissue which could help us interpose there. So gracilis flap interposition is what I was trying to discuss today. Obviously, we need to go down to the fistula, repair it well. Before that, we've done a cystoscopy, identified the fistula. Many times we pass a guide wire and probably a ureteric catheter and identify the fistula and loop it such that we reach the fistula, dismember the whole fistula and repair it. Men in their middle age and adults who suffer from this and continue to leak urine from the rectum, or those who leak fecal content through the urinary passage, preferentially more the former than the latter, are those individuals who suffer in agony and probably look at how and when to get it repaired. Rectourethral fistula is curable. It entails a complex surgical procedure with a planning towards the future, and it should be done for all individuals who continue to suffer with this entity. Thank you so much.